Andy Hales, and as you can tell from my accent, I'm from Australia. I do have Maltese roots, both my parents are Maltese. I have a love of sport, which is how I got into the profession that I'm in now. So being employed with LiveLife, I'm an exercise physiologist. Began my studies through sports science and developed within that what's known as exercise for rehabilitation, which is where I've come to this point today. An accredited exercise physiologist, let's break that down because it sounds quite fancy. Accredited obviously being registered with a body. Myself, I'm registered with Exercise Sports Science Australia, and you have to qualify with at least a bachelor's. Myself, I've got the bachelor's in exercise sports science and a master's in exercise for rehabilitation. The exercise word of the title is the modality in which we treat. Physiotherapists have passive treatment. As an exercise physiologist, our treatment modality is exercise. And obviously the word physiologist, coming from the word physiology, which is the study of human movement in my case. So obviously we're looking at treatments of humans with specific conditions through the modality of exercise. So it fitting with the philosophy of LiveLife, as the slogan suggests, the rehabilitation specialists. So that's what we're looking to do really. My profession is really specialized in exercise, so it takes the load off physiotherapists, occupational therapists, and also doctors, because there is a lot of evidence in the treatment of many chronic conditions with the use of exercise. Multidisciplinary is quite important to keep in mind, and it's really important to know what your role is and what other practitioners' roles are as well, to maintain that specialized approach. So it's a really important time to know when to refer, when things are out of your scope, and vice versa, when a physiotherapist or occupational therapist or any practitioner for that matter needs to know when it's time to refer. So going with that multidiscipline approach, we have to have a good understanding of when my treatment occurs, and a lot of the times it occurs at the subacute level. Subacute meaning at the mid stage or a little bit later in the rehabilitation phase. So a lot of communication in-house occurs a lot of the times at LiveLife. The programs that we have right now, one being the Rehab 12 plan. It's a 12-week program, 3 days a week, and it commences with quite clinically. We get quite a bit of information from physiotherapists or occupational therapists, or even the doctors as well, and we commence with a clinical approach in terms of our exercise treatment. And as we go on with our 12-week program, we progress quite active with our strength training, with our aerobic training as well. And as the weeks go on, we aim to empower the clients to manage their own health themselves. Well, we are known as the rehabilitation specialists, and we really take pride in committing to that philosophy. We've got specialized practitioners in their own right. Obviously, I really take pride in specializing in clinical exercise. Others look at specializing in neurology. So we're looking at specialized treatment. We're also invested a lot in state-of-the-art equipment. So we're really looking at focusing on specific treatment with specific rehabilitation equipment, and it's all in-house, which is fantastic. So any client or patient that we have, we all have a central focus on that patient or client, and it makes it easier to deliver whatever treatment we need. Well, it's all about inquiring. Don't be afraid to call, ask questions to our reception staff. If need be, we're all more than happy to discuss your case once transferred over. Don't be afraid to write an email on the websites, or even on our social media accounts on Facebook or Twitter. It's all about inquiring, asking the questions, and we'll take you on the right paths, because there are many options. It's a bit intimidating on where to start, so we'll guide you accordingly. But the most important is inquire, ask the question.